Oncology nursing. An oncology nurse is a specialized nurse who cares for cancer patients. These nurses require advanced certifications and clinical experiences in oncology further than the typical baccalaureate nursing program provides. Oncology nursing care can be defined as meeting the various needs of oncology patients during the time of their disease, including appropriate screenings and other preventive practices, symptom management, care to retain as much normal functions as possible, and supportive measures upon end of life. Now, questions. And question 1. Nurse Kate is reviewing the complications of colonization with a client who has micro-invasive cervical cancer. Which complication, if identified by the client, indicates a need for further teaching? A. Infection. B. Hemorrhage. C. Cervical stenosis. D. Ovarian perforation. And as per ovarian perforation, colonization procedure involves removal of a cone-shaped area of the cervix. Complications of the procedure include hemorrhage, infection, and cervical stenosis. Ovarian perforation is not a complication. And question 2. Which of the following immunizations should not be given to a 4-month-old sibling of a client with leukemia? A. Diphtheria and tetanus and pertussis, DPT vaccine. B. Hepatitis B vaccine. C. Haemophilus influenza type B vaccines, HIP. D. Oral poliovirus vaccine, OPV. And answer. Oral poliovirus vaccine, OPV. OPV is a live attenuate virus excreted in the stool. The excreted virus can be communicated to immunosuppressed child, resulting in an overwhelming infection. Inactivated polio vaccine would be indicated because it isn't a live virus and wouldn't pose a threat of infection. DTP, HIP, and hepatitis B vaccines can be given accordingly to the recommended schedule. And question 3. Which of the following tests is performed on a client with leukemia before initiation of therapy to evaluate the child's ability to metabolize chemotherapeutic agents? A. Lumbar puncture. B. Liver function studies. C. Complete blood count, CBC. D. Peripheral blood smear. And answer. Liver function studies. Liver and kidney function studies are done before initiation of chemotherapy to evaluate the child's ability to metabolize the chemotherapeutic agents. A CBC is performed to assess for anemia and white blood cell count. A peripheral blood smear is done to assess the maturity and morphology of red blood cells. A lumbar puncture is performed to assess for central nervous system infiltration. Question 4. Which of the following is the reason to perform a spinal tap on a client newly diagnosed with leukemia? A. To rule out meningitis. B. To decrease intracranial pressure. C. To aid in classification of the leukemia. D. To assess for central nervous system infiltration. Answer. To assess for central nervous system infiltration. A spinal tap is performed to assess for central nervous system infiltration. It wouldn't be done to decrease ICP, nor does it aid in the classification of the leukemia. Spinal taps can result in brainstem herniation in cases of ICP. A spinal tap can be done to rule out meningitis, but this isn't the indication for the test on a leukemic client. Question 5. Which of the following types of leukemia carries the best prognosis? A. Acute lymphoblastic leukemia. B. Acute myelogenous leukemia. C. Basophilic leukemia. D. Eosinophilic leukemia. Answer is acute lymphoblastic leukemia. Acute lymphoblastic leukemia, which accounts for more than 80% of all childhood cases carries the best prognosis. Acute myelogenous leukemia with several subtypes accounts for most of the other leukemias affecting children. Basophilic and eosinophilic leukemia are named for the specific cells involved. These are much rarer and carry a poorer prognosis. And question 6. Which of the following assessment findings in a client with leukemia would indicate that the cancer has invaded the brain? A. Headache and vomiting. B. Restlessness and tachycardia. C. Hypervigilant and anxious behavior. D. Increased heart rate and decreased blood pressure. And as for headache and vomiting, the usual effects of leukemic infiltration of the brain is increased intracranial pressure. The proliferation of cells interferes with the flow of cerebrospinal fluid in the subarachnoid space and at the base of the brain. The increased fluid pressure causes dilatation of the ventricles, which creates symptoms of severe headache, vomiting, irritability, lethargy, increased blood pressure, decreased heart rate, and eventually coma. Often, children with variety of illnesses are hypervigilant and anxious when hospitalized. And question 7. A child is seen in the pediatrician's office for complaints of bone and joint pain. Which of the following other assessment findings may suggest leukemia? A. Abdominal pain. B. Increased activity level. C. Increased appetite. D. Petechiae. Answer is petechiae. The most frequent signs and symptoms of leukemia are a result of infiltration of the bone marrow. These include fever, pallor, fatigue, anorexia, and petechia, along with bone and joint pain. Increased appetite can occur, but it usually isn't a presenting symptom. Abdominal pain may be caused by areas of inflammation from normal flora within the GI tract or any number of other causes. And question 8. Which of the following complications are three main consequences of leukemia? A. Bone deformities, sephiroctosis, and infection. B. Anemia, infection, and bleeding tendencies. C. Lymphotopoiesis, growth delays, and hirsutism. D. Polycythemia, decreased clotting time, and infection. Answer is anemia, infection, and bleeding tendencies. The three main consequences of leukemia are anemia, caused by decreased erythrocyte production, infection secondary to neutropenia, and bleeding tendencies from decreased platelet production. Bone deformities don't occur with leukemia. All top bones may become painful because of the proliferation of cells in the bone marrow. Spherocytosis refers to erythrocytes taking a spheroid shape and isn't a feature in leukemia. Mature cells aren't produced in adequate numbers. Hirsutism and growth delay can be a result of large doses of steroids, but isn't common in leukemia. And question 9. What are the three most important prognostic factors in determining long-term survival for children with acute leukemia? A. Histologic type of disease, initial platelet count, and type of treatment. B. Type of treatment and client sex. C. Histologic type of disease, initial WBC count, and client's age at diagnosis. D. Progression of illness, WBC at the time of diagnosis, and client's age at the time of diagnosis. Answer is histologic type of disease, initial WBC count, and client's age at diagnosis. The factor whose prognostic value is considered to be of greatest significance in determining the long-range outcome is the histologic type of leukemia. Children with a normal or low WBC count appear to have a much better prognosis than those with a high WBC count. Children diagnosed between age 2 and 10 have consistently demonstrated a better prognosis because age 2 or after 10. And question 10. In the clients with terminal lung cancer, the focus of nursing care is on which of the following nursing interventions? A. Provide emotional support. B. Provide nutritional support. C. Provide pain control. D. Prepare the client's will. And answer, provide pain control. The client with terminal lung cancer may have extreme pleuritic pain and should be treated to reduce his discomfort. Preparing the client and his family for the impending death and providing emotional support is also important, but shouldn't be the primary focus until the pain is under control. Nutritional support may be provided, but as the terminal phase advances, the client's nutritional needs greatly decrease. Nursing care doesn't focus on helping the client prepare the will. And question 11. The client with a benign lung tumor is treated in which of the following ways? A. The tumor is treated with radiation only. B. The tumor is treated with chemotherapy only. C. The tumor is left alone unless symptoms are present. D. Tumor is removed involving the least possible amount of tissue. And answer, the tumor is removed involving the least possible amount of tissue. The tumor is removed to prevent further compression of the lung tissue as the tumor grows, which could lead to respiratory decompensation. If for some reason it can't be removed, then radiation or chemotherapy may be used to try to shrink the tumor. And question 12. A female client with cancer is being evaluated for possible metastasis. Which of the following is one of the most common metastasis sites for cancer cells? A. Liver. B. Colon. C. Reproductive tract. D. White blood cells, WBCs. And answer. Answer is liver. The liver is one of the 5 most common cancer metastasis sites. The others are the lymph nodes, lung, bone, and brain. The colon, reproductive tract, and WBCs are occasional metastasis sites. Question 13. Nurse Brian is developing a plan of care for marrow suppression, the major dose-limiting adverse reaction to fluoxetine. How long after drug administration does one marrow suppression become noticeable? A. 24 hours. B. 2 to 4 days. C. 7 to 14 days. D. 21 to 28 days. And answer is 7 to 14 days. Bone marrow suppression becomes noticeable 7 to 14 days after fluoxetine administration. Bone marrow recovery occurs in 21 to 28 days. And question 14. The nurse is teaching a 17-year-old client and the client's family about what to expect with high-dose chemotherapy and effects of neutropenia. What should the nurse teach as the most reliable early indicator of infection in a neutropenic client? A. Fever. B. Chills. C. Tachycardia. D. Dyspnea. And answer is fever. Fever is an early sign requiring clinical intervention to identify potential causes. Chills and dyspnea may or may not be observed. Tachycardia can be indicated in a variety of clinical situations when associated with infection. It usually occurs in response to an elevated temperature or change in cardiac function. And the last question. The nurse is interviewing a male client about his past medical history. which pre-existing condition may lead the nurse to suspect that a client has colorectal cancer. A. Duodenal ulcers. B. Hemorrhoids. C. Weight gain. D. Polyps. And answer is polyps. Colorectal polyps are common with colon cancer. Duodenal ulcers and hemorrhoids aren't pre-existing conditions of colorectal cancer. Weight loss, not gain, is an indication of colorectal cancer. And my presentation is done. Now, Kahoot.
And we have a video.
Yes, I forgot.
With cancer and other blood disorders. A typical day for me involves anything from giving medications to patients, playing with children, whether it be coloring or doing whatever it involves to make them feel better. The biggest challenge of this job is emotionally dealing with the patients and being part of their lives on a day-to-day basis. We get to know them, they get to know us as family and friends. Some patients we see 5 days a week for 2 or 3 years. You've witnessed them going through hard times that no one should really have to go through. The number one thing I hear about my career is, I don't know how you do it. And I remind myself that the patients that I take care of are going to go through this regardless of whether they have a nurse that is supportive or not. And I want to be the person that makes this experience for them better than it could be. As an oncology nurse, we are multitasking every second of the day. If one patient doesn't need something, somebody else does. Math is very important on a day-to-day basis here in the medical field, and especially as an oncology nurse. A person needs to be compassionate, loving, hardworking. I think to be an oncology nurse, you need to want to do this job. I love my job, and this is what I've always wanted to do.
And now, Kahoot. Now. For which of the following conditions is a client with multiple myeloma monitored? Hypercalcemia is our answer. Which of the following client is most at risk for developing multiple myeloma? A 16-year-old African-American man. A client with leukemia has neutropenia. Which of the following functions must be frequently assessed? Blood sounds is our answer. Which of the following foods should a client with leukemia avoid? Carrot sticks. At the time of diagnosis of Hodgkin's lymphoma, which of the following areas is often involved? Neck. Which of the following conditions is not a complication of Hodgkin's disease? Blood infection. A centrally located tumor would produce which of the following symptoms? It's spreading. Which of the following statements is correct about the rate of cell growth in relation to chemotherapy? faster growing cells are more susceptible to chemotherapy. According to a standard staging classification of Hodgkin's disease, which of the following criteria reflects stage 2? One of two lymph node regions or structures. And the last question. Which of the following intervention is the key to increasing the survival rates of clients with lung cancer? And early detection. Let's move on. Congratulations, everyone. And that's all for today. Thank you for your attention. See you later.
Thank you.